Well, in Tuesday's House of Keys sitting, after the oral questions, of course, the written answers come through. And I wish I'd had this one time before I interviewed David Ashford, because certainly this one has caused a lot of concern, maybe, certainly surprise from the people. Lawrie Hooper is joining us now. Lawrie, you asked this question, it's a written question, about the excess vaccine, and you believe that it wasn't all being used, and you got an answer on this.
Yeah, so we'd heard a little while ago that they were managing to squeeze extra doses out of the vaccine vials, which is obviously great news. And it came up in conversation with someone that said, well, actually, what happens when people don't turn up for an appointment? What are they doing with the vaccines? And just thought, well, actually, let's ask the question and see what the protocol is for dealing with kind of spares or surplus doses, as it were. I'd expect there to be a small amount of wastage, because when I was down at the vaccine hub, they were explaining how they try and plan people in to make sure they don't open the new vial unless they think they're going to use it all. So they've got quite good systems in place when you're actually on the ground. But you're always going to have, I think, events where you get to the end of the day and you might have a dose left over that you just physically can't use. So that was expected. But what was very much a surprise was to find out that in 1 week they'd managed to waste 15 of these doses. And they'd managed to, because the answer given was very surprising, because David said it's because they couldn't find 15 people who were willing to travel to Chester Street for a vaccine. Now, I find that quite difficult to believe, actually. I thought they would have had some kind of reserve list in place. I know there's loads of people out there who are waiting for a phone call back from the 111 team to book an appointment in. I'd be very surprised if people get a call from 111 saying, can you get down to the vaccine hub today? I think most people would say, yeah, of course, I'll make an effort. So it seems like they have now got some kind of reserve list in place. But the question in my mind is, why wasn't that always there? And why did we have this gap? We've keep being told that vaccine doses are the determining factor. The supply is the biggest challenge to getting these things rolled out. And yet you find out that actually in 1 week they had 15 doses just going spare, which they couldn't use for one reason or another. It's very strange.
Yeah, I mean, I heard the headline 15 doses spare. I didn't realise it was over a week, so it's not necessarily that much per day. It could be just 1 or 2, presumably.
Well, it could be. I mean, they're only vaccinating 3 days a week. So you're right. It could very well be they were 5 one day and 10 the next, and nothing the third day. So, but I think the principle is pretty sound, that actually if you've got a lot of people on the island that need vaccinations to happen, you've got a list of people you're about to call to book in an appointment, you must have a list of people then who haven't been vaccinated, but you've got their phone number. It doesn't take a rocket scientist to put the two together.
I mean, I can even picture somebody just going out in the streets saying, anyone want a vaccine before we close up, almost, and there'd be lots of people interested, surely.
Yeah, I would have thought if the staff had been given that kind of flexibility on the ground, I'm sure they would have done. I'm sure they would have gone out into the street from the Chester Street hub in Douglas and just shouted at the top of their voices. But it seems that the decision's being made further up the chain by a vaccine board, and that's what I find quite bizarre. If you empower your frontline staff and say, you guys know what you're doing, if you know you're going to have some doses spare, just get them into people, you'd think that if they'd been able to sort that out. This
is down to protocols, which is what you're saying there, isn't it? I can't do it because I'm not allowed to by the big book that says this is what I've got to do, which is pretty disappointing in a small place like the Isle of Man that can't be more flexible.
Yeah, that's what frustrates me, I think, is the people at the vaccine hubs are doing their absolute best to roll this out as quickly and efficiently as possible. And it seems like, once again, we've got a decision that's been made somewhere further up the chain that's almost going against all common sense and is just stopping people from doing their jobs. It's just bizarre.
And, of course, if this hadn't been raised, presumably it could have continued this way, which is, again, almost incredible to believe that it could happen in the first place, but it's probably been going on for some time.
Yeah, so in fairness to David, the answer that he gave did say that they've now got a protocol in place for what they're calling a reserve list of a number of people on standby who could come down earlier. So that seems to be they've got it sorted now. But the question in my mind is, why wasn't that set up from day one? I mean, if I was going to set up a vaccine hub, there's two big questions I'd be asking. And the first question is, how do I get people to the hub? Which they still haven't resolved. I still haven't had an answer about, if I'm living in Andreas, how do I get easily down to Douglas or the airport without needing to catch 3 buses? They still haven't solved that problem. And then the second question is, well, after I've got people there, if someone doesn't turn up for an appointment, what do I do with the spare vaccine dose that I've now got? So they're two very basic questions I thought they would have had answered from day one, and it seems like they haven't.
Well, let's talk about the North. I mean, you haven't got a hub. Peel had a special day for doing people who couldn't travel. Ramsey, there's been some GPs involved, I think, yeah, but there's no hub at all, and that goes on, which seems to be like there's places they could do this if they wanted to.
Yeah, again, they did a pop-up in Ramsey, which I think was great for people that couldn't travel. I think from my perspective, it needs to be broader. It needs to be, there's a lot of people who can travel but find it very difficult, and I think that's the criteria I'd be setting, saying actually if you're going to find it very hard to get down to the airport or to Douglas for your vaccine, we'll come back up to Ramsey, even if it's only once a month. We'll come up, and like they did, do 200 people in a day. I think they did the last time. I don't think there's anything wrong with that. Telling people we'll book you all in, we'll do a session in the north, and we'll do 200 or 300 people in a batch, as it were. I don't see why that's not possible. They've done it once. I fully expect them to keep doing that. If I'm honest, I don't think it was a one shot. I'd like to think they'll keep doing it. But if they aren't going to bring the vaccine to people, they have to make it easy for people to get to the vaccine. Again, not rocket science, this stuff.
And of course, having another hub would have cost a lot more money. I mean, we're hearing incredible figures about what's cost at the airport and especially at Chester Street. I mean, but as you say, you haven't had an answer about how people get from Andreas to one of the hubs.
No, so
have you?
I've been asking this question for weeks and weeks now, to say actually we appreciate that if you can drive, that's fine. If you've got friends and family, that's fine. But actually, a lot of people don't have that kind of family support network, and they need to find an easy way of getting down, especially when they're getting to the airport. Douglas is a bit less of an issue, obviously, but getting to the airport is a real challenge from the north, which is why the DOI put on the bus, the Connect Port service that will pick you up from your home and take you down to a flight. And what's totally bizarre is if I want to get on a flight, up until lockdown, if I wanted to get on a flight today, I could book that service to get me from my doorstep to the airport. But if I want to book the same service to get down for a vaccine appointment, they won't let you do it. Totally bizarre. And
just to finish with on that, are they still sending people from the north in your area to Castletown rather than just to Douglas? Is that actually?
Yeah, and they are, and I think that comes down to, again, it's where the vaccine is. If you can get there, they've got the two hubs up and running, and again, I don't have a problem with that. The people I've talked to don't have a massive problem, with that in principle. But the question is always, I'm more than happy to go to the airport, but can you make it easier for me to get there? That's always the question, and at the moment, I still haven't had any answer from the DOI or Health. Actually, we're in the third month now of vaccine rollout, and they still haven't managed to get something simple like a bus route sorted.